As you hit the malls and decorate your home, maybe you're noticing, some of those aches and pains. Dr. Michael Gilbert, owner of Gilbert Physical Therapy, joins us to specifically talk about hip pain due to arthritis. Okay, you always bring us such great relief to the show. So how can you help hip pain, sir?
Well, the biggest thing that we do with any kind of hip pain is we're going to address it by looking at what has caused the hip to be painful in the first place.
Okay.
We do that through a variety of tests and measures that are going to tell us exactly where the problem is coming from. Now, let's take something like hip arthritis, for instance, and I'll show it on the model here. Where the arthritis becomes located in the hip is right here on the ball of the socket. Now, the hip should do a couple different things. It is going to flex forward, it's going to do what's called abduct, and it's also going to do what's called extension. Now, at any point here, and in particular with arthritis, you may have that hip have a restricted amount of range of motion in the joint.
Okay.
So we would look to do specific stretching and strengthening exercises as well as hands-on treatment in order to free that up and make it work better.
So I guess sort of goes along with my next question is obviously there's lots of different types of physical therapy, and I'm sure you cater the different physical therapy to each patient and each ailment. But can you explain a little again of what you would do for hip arthritis?
So the biggest thing that you would want to look for from a physical therapy standpoint is manual hands-on treatment for the hip. This is done through what's called immobilization or manipulation, and that's what a therapist would do one-on-one with someone. So they would do a specific technique. The second thing that we have people focus on is land-based physical therapy. That's where they're up doing weight-bearing activities if standing up out of a chair is a problem, or if just basically walking is a problem. Then you want to have someone up and actually working against gravity so that they build their muscles up strong enough to withstand that activity.
That makes perfect sense. Now, if you are suffering from one of these ailments, whether it's the arthritis in the hip or any of the other ailments you've talked to us, you do not need a doctor's recommendation, right, to go to you?
You do not. You can come in directly to see us. If you have any questions from an insurance perspective, you can call our office and we can answer any of those questions for you.
Okay. Do you want to point out that you always bring us sort of a little a seminar to tell us about, so you have another one coming up? We
have an upcoming seminar. It's on December 12th. It's going to be on arthritis. It's going to be on total joint replacement as well. So if you're out there and you're thinking about getting a total joint replacement, you know someone who is, this would be the workshop for you to attend, December 12th at 5:30. And we just ask folks to call in first to register.
Right, to register. But then you have another, this is an incredible offer. You have a special offer just for Good Day PA viewers. Tell us about that one.
So this is just for the Good Day PA viewers who are listening to the show today. We're going to give away 30 free screens for anybody who's dealing with a sports injury, a back pain, neck pain, if they have trouble walking or balance issues. For anybody who's listening to the show today, you can call our office, mention that you heard our offer on the show, and we're going to give away 30 free screens to the first 30 folks who call.
Pick up those phones. You get that Thanksgiving dinner ready. Pick up the phones now. First 30 people. Incredible. And then just remind us where you're located. We'll put your phone number back up on the screen.
So we're located on the Carlisle Pike. They can reach us 591-0955, and we look forward to hearing from them.
Okay, well, thank you, Doctor. Thank you, Stan. This is Stan, by the way, everybody. So thank you, Stan, for being here today. We hope to see you again. Hope to see you again, too, Dr. Gilbert.
Thank you, Amy. Okay.